Well, I'm Tom Crowley. I'm 56 years old. I'm a jeweler. I own this jewelry store we're sitting in. One morning I woke up, it was a Wednesday morning, and I couldn't get back to sleep. I still had an hour or so to go before I had to get up for work, and I had this heavy pressure right here in my chest. And pain kind of rose through my shoulder and into my jaw, and I didn't feel right. First I took my blood pressure. I have a machine at home. And 3 times it was consistently way too high. It was like almost 200 over 120. So at that point I decided to take the baby aspirin and to call 911 because I wasn't taking a chance. Turns out I had a heart attack.
Came to the hospital, ongoing chest pains, bad episodes. One of his heart enzymes came elevated, and that's usually a worrisome sign indicating, blockage in the heart. So we ended doing heart catheterization on him, and it was found to have critical narrowing of the main trunk in his heart. That's the vessel that supplies almost 80% of his heart with blood. So there was no other option but to send him for open heart surgery.
When they told me I was going to have open heart surgery, I was shocked. I couldn't believe it, and I was nervous. They did tell me the doctor's name, and as I said, I met him. But I went to Google right away. After I Googled Dr. Metcalf, I found out that, he was from Texas, and he went to Harvard Medical and studied at the clinic under the top heart surgeons. Had a practice in Philadelphia with Dr. Priest for many years. Each had done 8,000 of these operations, surgeries, and successfully. So I was pretty well at ease about the whole thing and having it done here at Trumbull Regional Medical Center. The care that I had prior, everyone explained to me what was going to happen, and in terms that I could understand, not medically and speaking over my head or anything. So I really was just at peace with having this done there at Trumbull. Fortunately, my heart was actually strong. I received very little or no damage when I had the heart attack. So that was great because I was able to heal probably faster than most. Well, I started cardiac rehab about 8 or 9 weeks after my surgery. Basically, it's to strengthen the heart further, get everything flowing real good, circulation, and build your strength and stamina.
Cardiac rehab program is comprehensive at Trumbull Regional Medical Center. Patients that do cardiac rehab reduce the risk of cardiac-related death or mortality by 47% and reduce the risk of future heart attack by 31% over 12 weeks. Tom is a great example of this.
I would highly recommend the cardiotherapy at Trumbull. Just the program is fantastic, the machines are up to date, and they know what they're doing. It's not true that you have to go to Cleveland anymore. They have a facility here to handle the biggest cases and the hardest cases. Their heart unit is, I think, bar none. Every time I tell a story to someone, I say, just go to Trumbull Regional Medical Center, hands down.